Hello everyone, this video is brought to you by Minnesota Aging Pathways, formerly known as the Senior LinkAge Line. Today we will be reviewing how to use the official Medicare.gov website to compare Medicare healthcare plans. When you first log on to Medicare.gov, you will see a slightly different screen than you will the rest of the time. This pop-up will be in the middle of the screen. This will allow you to sign up to get important reminders and information about Medicare. This is optional. If you would like to do so, you could add your email address here, review the data privacy policy, and follow along with the steps. If you are not interested, just click the X to remove this. This is how the Medicare.gov website will typically look. If I scroll up to the top of the page, you'll also see this, and here's the friendly, here's how you know. This website has a lot of little pop-outs like this depending on what page you're on. Usually you can click on it to open it and click on it to close it. So here it's reminding us about the official websites use the .gov and the lock icon being a secure website. So I'm going to click this again to remove that. And here we are on the landing page. Anytime there is a update, you'll often find it on this page. We'll also see handy things that are upcoming or news information. And here we see open enrollment starts October 15th. We also have the option for Welcome to Medicare, Get Started with Medicare. You could click into this and follow along and get some more information about Medicare itself if you need to. This video is focused on how to use this website to use the Plan Finder tool. So if you're interested in doing a plan comparison all the way up to enrollment into a plan, you can use the Medicare.gov website. As I scroll down on the page here, again, we'll see some additional videos and information. The site menu is also down here at the bottom of the page. But let's focus on the Plan Finder today. So, for the Plan Finder, we have a couple of different options. The first option is to create an account and or log into an existing account with Medicare. If you are interested in that, you could click here for Login, Create Account. So what are some of the benefits to creating an account? You can get a summary of your current coverage. You can add your drugs and pharmacies. Use your saved drugs and pharmacies to compare plan costs. Access your Medicare and You handbook and more online. This will also let you see the estimated costs for your medications if you are on LIS low income subsidy or extra help. Having an account makes it easier to have your information saved, which makes it easier to get into a new plan and start doing plan comparisons. In order to create an account with the Medicare.gov official website, you will need to complete two-factor authentication. The two options for this are to use a laptop or computer that has email access, or to use text messaging on your mobile cell phone device. If you can access the email, the authentication can go through the email, and if you have access to text messaging, the authentication can go through your text message. If these options do not work for you, you can also try calling 1-800-MEDICARE. If you do not choose to create an account, you can still use this Plan Finder. You'll just have to enter your information each time, and you won't see quite as much personalized information. At any time in the future, you could choose to create an account, but let's proceed as if we do not have an account at this time. I'm going to click on Medicare.gov to go back to the home page. I could click here to find plans, or there's always a tab right here. Find health and drug plans. Find and compare plans in your area. Let's get started here. I'm clicking on Find Plans Now, and the next page pops up, and as you can see, we have some things here that could pop out. Another tab has opened talking to us about open enrollment. Of course, this is October 15th through December 7th. I will close this tab to get us back to the Plan Finder. So here again, you have that option to log in or create an account. And over here, we have Continue Without Logging In. So we're going to be looking at plans for 2026. If we needed something before then, we could easily select this, go back to 2026. And for this, we're going to start with our zip code because plans are only available in certain areas. So we've typed in a zip code. We're going to click Continue. And now we have the option of which type of plan would we look at. Today, we're going to focus on Medicare Advantage Plan, also known as Medicare Part C, where we're combining our coverage together, and Medicare Drug Plan, Medicare Part D, prescription drug coverage. We can switch anytime between these, so it's okay to start with one or the other if we're not sure. There's also Medigap policy information on this website, but today we'll be focusing on the Advantage Plan and Drug Plan. So here I'm clicking Advantage Plan. I'm going to select Find Plans. And this is a good page to get a little bit more information about what's unique to your healthcare needs. So this page is asking if we have any of these types of assistance. Do you have Medicaid and Minnesota medical assistance? If you have this, you could select this. This will show you estimated costs based on if you have that. And it will also show you dual eligible special needs plans if you're in that category for eligibility. Supplemental security income or Medicare savings programs or extra help LIS with drug costs. If you're not sure about these, you could click here, handily get a pop out here, tells you a little bit more about each of these programs in case you're not sure. I'm going to close that. And now you can select, I don't get help from any of these programs. This is also a good option if you're not sure about these, because by selecting this option, we're going to see estimated costs without assistance. This will let us know what could be the maximum potential cost for this in case we don't have any of these assistance programs. Or if something were to change and you were to lose this coverage, this helps us get a better idea of what it would look like without these types of assistance. So I've selected I don't get help from any of these programs. I'm going to click on continue. And do you want to see your drug costs when you compare plans? You do not have to enter your drug information if you do not want to. It is highly recommended, though, if you have any type of drug information to enter here, because this will give you the best estimated cost for your plan that you are looking at. So we're going to select yes. And again, if we had an account and we're logged in, it would save this information for us so we would not have to do this every time that we do a search. We're going to click next. And here's the handy toolbar for entering our drug medications. As you can see, we have different options here. We could start typing in. We could browse drugs A to Z. This handy pop out over here on the right. Select by letter. It'll jump down to there, or you could scroll through the whole list. And you can see there are a lot of drugs on this list. So we're going to close. Now, there are a few ways that you could make this process a little bit easier. If you have a printout of your current medications, that would be handy to be able to spell the medication names and correctly identify the doses that you have. If you don't have that, perhaps you have something like an app on your phone that is connected with your healthcare that would list your medication list there. Or you're at home and you have your prescription pill bottles handy and you can read them off from there. So what we're going to do is we are going to start entering our medication list here. And I'm going to enter some pretty common medication names. All right, and I'm going to start with atorvastatin. And as I type it in, options will come up. And there I see it, atorvastatin. Click on it. Then I'm going to click add drug. And now we want to check the dosage. So how much is this tablet? So we see it's a tablet. We have these options. It's going to start with a default amount. You can change this to whatever one fits. If your dosage does not fit what is in here, you'll want to check the name of the medication to see if there are any other identifiable parts to that name. Does it, for example, have hydrochloride added onto it? Is it extended release? So these are the things to check in case it's not showing up. So we have the dosage, we have the quantity, and this quantity is tied to the frequency. So for this medication, we're saying that we take a 40 milligram tablet approximately 1 time per day. So we're going to add this to the drug list. It'll pop up here. We could edit it if we made a mistake. We could remove it if we wanted to try something else or take a look at what our plans would be without that medication. For example, if you were to find one medication and it's not covered by any plans in your area, you might want to discuss that medication with your doctor to see if there's another option. Perhaps another medication is covered by the plans and you could make a switch if it is the right fit for you. But let's continue on. Add another drug. We're looking for hydrocodone with ibuprofen. Add drug, 7.5, 200 milligram tablet, quantity 120 every month. Add to my drug list. And we'll just keep going through this drug list. You could add as many of these as you need to. So we'll want to take a quick look at our medication list. Make sure this matches what we have at home or our documentation has. See that we've got everything in there. Make sure that the dose, the quantity, and the frequency all match. Again, if we needed to, we could remove drug, edit drug, add another drug. If you wanted to keep a handy list of this for the next time, if you were not going to create an account, you could click on print, select save as PDF, choose where you want to save it, and save. And then you would have this handy list for entering next time in case needed. But let's keep going on with the plan finder here. So here we've got our drug list. And so we're going to click here on the green button, Done Adding Drugs. And now we can enter up to 5 pharmacies. And this is where we are going to want to pick up our prescription medications from. Say you've only been using one pharmacy and that's your preference. You can enter that one, but you might want to enter a couple more in case they have a better option. Perhaps one pharmacy has a better rate with a plan than another one. So there are a few different ways that you could enter these. It has a list here based on the zip code that you entered, the location that you said you were looking for your plan. So here on the left, we have just a list of these in order. And you can go over here to the map. You can highlight on the tab and see where they are. Number 2, Fond du Lac Pharmacy. Number 2, Fond du Lac Pharmacy. So if you needed to, you could scroll up or down on the map here and get a closer look. Or if you're familiar with the names, you could go through here. You also have the option of typing in a specific street address or zip code here. We already have a zip code, so we don't need to do that. But you could if you wanted to get a specific location. Or say you were trying to help a relative with this, you could enter their location. If you're not able to find the pharmacy you're looking for, you could type the name in here, click Find Pharmacies. You could use the current location. You could also filter by how far away these are. Maybe you travel a lot or work in a different area and you want to use different pharmacies. The Plan Finder tool here is made to fit your preferences and your needs. We also have the option for mail order pharmacy. This is a good one to click if you just want to compare so you know what the mail order option would be. And so I'm going to scroll down through this list. I'm going to select a few pharmacies. So we've got Essentia Health there. We've got a Walgreens. I can click on more of these, or I can just click Next. And as I click Next, you can see that the map changes to show the different ones. So we had 1 through 10 before. Now we have 11 through 20. Again, you could see where they are. There might have even been a pharmacy that you weren't familiar with that is in the same area that you're already going to. And so let's add just a couple more here. So we'll add CVS. And we'll add Cub Pharmacy. So as you can see, each one I've added has gone down here. If you have one that you don't want to look at anymore, you can press the X to remove it. You could have just one in here if you wanted, but you could have up to 5. So we've selected our pharmacies. We're going to click here, Continue to View Plans. And now this is the page where we are able to start comparing plans. Based on our location, we had entered a zip code for St. Louis, Minnesota, St. Louis County, Minnesota to be specific. We could change the location at any time. We could also switch the plan type. So say we're looking at Advantage plans to start and we're just not finding what we want, or we want to take a different look. We could switch here to prescription drug plans and it won't change any of the information that we've entered so far. We'll do this after we take a look at some of these Advantage plans. Also, there's a notice up here that we are viewing 2026 plans. We could switch to 2025 plans if we needed coverage that started before 2026 and we were eligible to start coverage before 2026. We can also go back to drug and pharmacies if there's something we wanted to change or make an edit. Right now we have special needs plans turned off. We talked about this a little bit earlier in the video, to where if someone was receiving medical assistance and was dual eligible, because we selected that we do not get any type of assistance, this is defaulted to no, but we can switch that at any time if we'd like to. And over here, you can filter by the type of plan. So for these ones that are popping up, we're seeing Preferred Provider Organization, PPO, cost plan. Again, here's a handy pop-out if we wanted to learn more about plan types. We'll click the X here to close that. Plan benefits, you could select specific things that you're looking for. Insurance carriers, if there's a certain company that you want to include or exclude. Drug coverage, whether it has it or not. Star ratings, and then you could view all filters here. Now, by default, it's going to sort plans by the lowest drug and premium cost combined. You can switch this to the yearly drug deductible, the health plan deductible, or the premium. Typically, we go with the lowest drug and premium cost because this is the total estimated cost for that plan for the time period. So let's stay with that. Over here, it lets us know that right now there were 18 Advantage plans in that area that matched what we entered, and it's showing 10, and we would have to click to the next page to continue. So the plans are, again, sorted by what we have selected here, the lowest drug and premium cost. So this first plan here is the lowest estimated drug and premium cost for what we have entered. So here we can see the name of the plan. We can see the plan ID. So the specific ID for that individual plan. Underneath that, we'll see what the monthly premium is. It lets us know that this is for health and drug coverage. There is a reminder that this does not include the standard Part B premium. You could click in here if questions about the standard Part B premium. And then here we see that total drug and premium cost. So this is estimated at $955.65. Other costs, there's no health deductible. It has a $250 drug deductible, and the in-network maximum you pay, $5,900. Over on this side on the right here, we can see some of the initial plan benefits. You can click here to see more benefits. So this also gives you a quick, handy idea of some things it has if that's what you're looking for or not. Copays and coinsurance, these are typical for each plan. We could click in here to see more drugs and their cost information. Now, we'll go into plan details here in a minute, but let's stay on this page first. So again, here we've seen the name of the plan, the premium, the total estimated cost. So at just a quick glance, we could look through here and we could see that, okay, here's another company. The premium is $38 and the drug cost is $957. So not that far off from the first one. But we can also see that this one has a much higher drug deductible and the in-network costs are higher. Just by scrolling through here, you can get an initial idea of some of the plan information. Now, what do we do if we want to compare these or to get a closer look at the plans? So we're going to scroll back up, and so here's our first plan. So here is plan details, and if we click into plan details, this will give us the full details for this plan. Again, we have the ID, we have a link here to the plan website itself, we have a phone number for non-members, and we have a phone number for members. So if you were a member of this plan already and had coverage questions, you could contact them here. Or if you are a non-member interested in this plan, you could contact them here. So what you'll pay, it breaks it down pretty quick. And an important thing to notice right away, if we're doing medications, is covers 6 out of 6 drugs. That's a good sign. If it said that it only covered 5 of the 6 drugs, we'd have an issue where that medication we'd be paying full cost for. So as you scroll down through this plan, you could also click on the tabs to scroll down faster. But let's just take a leisurely scroll through this plan. So here's the overview, again, talking about the premiums, reminders about the Part B monthly premium, and then we get into the deductibles, and it reminds us what this is, the amount you must pay. We get the max cost, plan contact information. And as I scroll down, you can see that this tab switches over to benefits and costs as we get to benefits and costs. And doctor services. This is where you could view your provider network directory. This is very important for an individual to do. This is how you know if this plan is going to work with your doctors. If you want to keep your current network, that should be a starting point for you. We'll also see some basic estimated costs here. Doctor visits, specialist visits. If it's in network, here's the copay amount. Test, lab, and imaging. Maybe you have a high need for MRIs or lab services. These numbers could be very important to you. Inpatient hospital, skilled nursing facility, preventative services, ambulance. There's also this blue bar here, view more benefits and costs. This just pulls up more stuff. So in case you needed information on these items, that would be there. And as we continue down, we get to drug coverage. Friendly reminder, if you wanted to check out to see if there was ways to help lower the cost, you could click and follow into there. Here we see our drug list. Again, we could make changes if we needed to. We see the name of the drug, the quantity, frequency, and here we see whether it's brand or generic. We scroll down here and now we see our pharmacies that we selected. Walgreens, in-network, green with a check mark. This means that this plan will work with this pharmacy. We see the same for Cub, we see the same for Essentia, and we see that this CVS pharmacy is out of network. So that one we would pay retail cost at. Again, this would help us find a pharmacy that is in network for this plan. And then down here we see preferred. So you could be out of network, in network, or preferred in network. Preferred in network is typically going to be the lowest cost option. But as we can see, these ones are also in network and would work with this plan. And here it breaks it down further as far as how much each medication would cost at these locations. And just at a quick glance, we can see that these ones are in the hundreds and this one goes up into the thousands. And that's because it is an out-of-network pharmacy. Here we see information on the Medicare prescription payment plan. Click here to learn more about this and see what your drug costs could look with this option. We want to look at this option if it is important or needed for your individual drug costs. And here we'll see the estimated total drug cost and premium, when you would meet your deductible, if you wouldn't meet your deductible. And here it notes that you wouldn't meet your deductible, and that's because they have to be at a pharmacy that's in network. Otherwise, your costs don't count towards the deductible. And here we'll even break it down by month And we see that for mail order pharmacy, it's not showing every month. And that's because mail order typically does a bulk order of 3 months at a time, which is part of the savings for this option. Again, out of network, we're seeing retail costs. And if we wanted to, you could click individually into here to see what the drug cost would be during the coverage phases. Retail cost before deductible, after, once you meet the cap. You can see the amounts change as you go through the coverage phases. I'll click the minus here to close that out, but we could do that for each one of these. Again, we have a blue bar here with view more drug coverage, and this allows us to look if there was a difference between generic, preferred brand, non-preferred drug, specialty tier. And here we see what tiers the medications are on, if they require a pre-authorization, if they have quantity limits, if it requires step therapy. These are all things that are important to know about your medications and that you can discuss with your medical provider. A little bit of information on Part B drugs. And now we get to extra benefits. Original Medicare by itself does not cover hearing, vision, and dental. Advantage plans are sometimes the way that people get this coverage and one of the benefits of having an Advantage plan. So, if any of these are important to you, you're going to want to check out this section. And if these things aren't important to you now, it's good to know about them in case anything changes to your health in the future and it becomes important to you. So here we see some basic information on the hearing costs, dental costs, comprehensive dental. So just on the surface, if I wanted to have some hearing, dental, and vision costs, it looks like this plan has some of that. And we get into medically approved non-opioid pain management services, specific but important to individuals. This one does not cover those items, so this might not be the plan if you were looking for these items. We get down into more benefits here, and this is where it explains things that are specific to this plan. It has a fitness benefit, transportation not covered. So again, looking for what fits your needs. And then we scroll down here and we get the star ratings, and we could pop those out for those if needed. So now that we've gone through all the information, all the plan details for this one plan, how do we compare these? So I'm going to scroll back up to the top of the web page here. And on Medicare.gov, it's handy to use the arrows on the website itself, not on your browser. This helps to make sure that your information stays there. So I'm going to click back to search results, and the page is going to reload, and we're right back where we were. If I wanted to compare a few plans here, instead of clicking on plan details, I can click on Add to Compare. And similar to the drug pharmacies, we can enter a few here. We can enter up to 3 of them. So let's take the ones that have the lower one. So we've got a Medicare plan, and now let's look at a United Healthcare. And we've got a couple United Healthcare in a row, so let's skip down to a Medica one just for demonstration. Have 3 different ones here. As long as I've entered at least 2 here, I can click Compare. We've entered 3, so I'm going to click Compare. Now, this view will not give you all of the information that the individual plan details will, but this is a handy starting point to get just a quick glance at what's different between these plans. So right off the bat, we can see that there is a difference in the monthly premium cost. $58 all the way to $92. So these two don't have a health deductible. This one has a $50 in-network. $250 drug deductible, up to a $615 drug deductible. Max you pay for health services, $5,900. $10,000 in and out of network, $67 in network, $67.50 in network. So this is where it's also handy to maybe have a calculator out, because you might be paying more per month for a plan, but maybe it saves you more on the maximum that you would pay for health services. This is where it's specific to the individual and what meets their preferences and their healthcare needs. So if you are using this, make sure that you are focused on your individual needs. A plan that works for your neighbor, your spouse, your cousin, your mailman won't necessarily work for you. Every person is different, and every person's healthcare needs are different. We continue to scroll down here. We see plan features. So as we talked about, that first one we looked at looked like it had all of those. This one doesn't have those. Maybe the hearing benefit is really good on this one, though, for your needs. We scroll down. Is it a copay, co-insurance? This one's looking more co-insurance than copay. And you can just continue to scroll through here. So we talked about those extra benefits. So these two have pretty much the same amount for theirs. Despite the cost differences, these ones have almost the same hearing coverage. Preventative dental, not covered. Comprehensive dental, these two plans don't. This one does. Are eyeglasses a need for you? This plan's probably going to cover it better than these two. So as you can see, by comparing these plans, we can at a glance quickly see which plans are going to be a better fit for us. One good thing on this one is that all three of these plans would cover all 6 of the medications selected. And if CVS Pharmacy at that location was really important to you, maybe this plan's a better fit then, because this one covers CVS while these two don't. So we're done plan comparison here. We're going to scroll back up to the top. We're going to click on here on the website for back to plan results. And we're done comparing plans, so we can remove these. If we wanted to, we could throw a different one in there. Whatever we need to do, we could compare on here. And at this point, it looks like this plan is the best fit. It covers the extra plan benefits we were looking for. It's the lowest estimated total cost for the year. It matches the pharmacies we selected. It covers all of our medications. It looked like the copays were within our budget. So if we wanted to, we could quickly change this to 2025 plans. The page will reset. The cost will be different because it's showing for the rest of 2025, and this video is being recorded in October of 2025, right before open enrollment. So that's why we did not see the enrollment button on the other one. But after October 15th, the plans for 2026 will have this enroll button. If you were to click on enroll, it's letting us get ready that we are going to need our Medicare card. We're going to need that red, white, and blue card that has our Medicare number and the effective dates. What healthcare coverage do you have already or existing? That's going to be important information to have. Dates that any changes could take effect, like if you were going to move locations. You'd click on Join Plan. This is the start of your application. It's reminding you of what you've selected. You're confirming your enrollment period. Right now, because it's right before open enrollment period, we would have a special enrollment period or we'd be new to Medicare, and we would select our information there, select where we live, etc. Click Next, and you would continue on with the enrollment process. An important note is that when you complete the enrollment process, you will be given a confirmation of enrollment number. You want to keep record of this, whether you print out the page and save it on your computer or you take note of the number. If you do an enrollment through the Medicare.gov Plan Finder, please keep a copy of your enrollment confirmation number. And I'm going to switch back to 2026 plans. And again, it's just a click of a button to go through there. You can see we're right back where we were, and where that enrollment button normally is, right here we're seeing the reminder that open enrollment starts on October 15th. So we're just a couple days early for that button to be there. Now, we also talked about just prescription drug plans. So say you've looked at the Advantage plans, you've narrowed it down to this one, but you're not sure if you need an Advantage plan, maybe you just need a drug plan, or you have other coverage that you're only going to need a drug plan. So you don't have to start over with everything. You can just go up here and click on Switch Plan Type. So right now, we're on Medicare Advantage Plan, Medicare Part C, where we combine our different plans, and we want to select Medicare Drug Plan Part D. We've selected that, and now we click Find Plans. So by default, it's kept us in the same area. It's kept our same drug list, and what's just changed is that now we're looking at prescription drug plans, aka PDP. So right off the bat, you can see if your pharmacies are in network, what your monthly premium would be, and how much it's estimating for your costs. And just like the Advantage plans, we could click in here for plan details. Great news, we see that it covers 6 of 6 drugs. We see the drug deductible is $615, and here we could scroll through just like we did with the other one. And for this, every option is in network. So it's more based on your preference. And so I'm just going to scroll up because we've already done this with the Advantage plan. I'm going to click on Back to Search Results. And just like the Advantage plans, we could select a couple to compare. So let's just take 3 different companies. They pop up down here. We'll click Compare. And right away, we can see quite a difference in the monthly premium. Yearly drug deductible, the same for all of them. All 3 cover the medications. And we see that these are all in network, but the WellCare Classic has a lot more preferred in-network options. We'll click back to Plan Results. Let's switch this back to Advantage Plan, Find Plans. And we're back to the Advantage plans where we could continue looking through this. Now, the Medicare Plan Finder can be used any time of the year. Your ability to enroll in a plan will depend on if it is an enrollment period or if you have a special enrollment period specific to your individual healthcare. You could check this at any time as things can change. So perhaps you want to take a look at things and do a plan comparison in October. If you're doing this during open enrollment, your new plan won't start until January 1st, and you have until December 7th of the current year to make an enrollment for January 1st of the following year. So if you wanted to, you could check this out in October and then maybe come back in a few weeks in November and check it again to see if anything has changed or if there are different options for you. Or if something in your life has changed, or you're going to move, or you have a new medication, whatever it might be, you could come back to this website. I'd like to thank everyone for watching this video. Hope it's been helpful to individuals that would like to take control of their own health care and get a first-hand look at what their estimated drug costs could be when they're comparing both Advantage plans or drug plans using the Medicare.gov website. Thank you, everyone.